yet another addition to the good things we can achieve through collaboration between the private sector and government tertiary institutions like this. Distinguished ladies and gentlemen, it's a good thing we're doing, and I must stand up on behalf of the Lagos University Teaching Hospital, acknowledge your noble gesture in helping us to rehabilitate our children's emergency center. This center is a temporary, and as Yemi must have told you, it's something we are using now to see hundreds of patients every week, over 1,000 children every week, whereby these are children that have nowhere else to go. They die if we don't see them. LUTH does not refer patients to anywhere. To the best of my knowledge, both accident and emergency and the children's emergency. Any child we reject here, and we don't reject anybody. Even if two have to stay on the same court, it's better than to let them die. So I must commend the hard-working people, those unsung heroes of ours, the doctors, the nurses, the pharmacists, the attendants who work in children's emergency. Shall we clap for them? Because we don't ever mention them. But they work morning, afternoon, and night. Believe me when I tell you, some of them catch diseases that children bring to us. Am I right? And they go home for weeks. The families catch this from them sometimes, all in the service of humanity. But we can't stop. So it's a delight today to hear that your company has thought it fit to contribute this generously to the upliftment of that center. Like I said, I emphasize the fact that that is a temporary center for a purpose. We now have the brand new children's emergency building, which is Olori's building, which is nearing completion, where we need to populate it. It's going to add another 200 beds solely for children to this hospital. God, and may they always seek and get help here. In the name of Jesus Christ our Lord. Amen. So this is where you come.
Management of LUTH under the leadership of Professor Bode for giving us the opportunity to come in and make a difference. Because I mean, obviously it's nice to have ideas, but if you do not have the platform to relay your vision, then it's pointless. I would also like to say thank you to the pediatric department, particularly Dr. Oshinaiki, as you have heard people say. He's been inspirational to this project, and he has been pivotal to ensuring that we have implemented it to the point that it is. Obviously our sponsors, PZ Cussons, particularly Cussons Baby and Premier, for believing in the vision and agreeing to partner with us to make this a reality. We appreciate you deeply. We all know that healthcare in Nigeria is not where it should be. We know that the problems are multifaceted and funding is a large issue. And then when we have available funds, we tend to think of the staff, the buildings, some equipment. But we do not think enough of the social and psychological needs of our patients and their caregivers while they are in the hospital. And that is what this project aims to do. It aims to cater to the social and psychological needs. So we are creating a healing environment. We have done murals on the wards to make it more child-friendly. I had heard of patients who came back from the States with a rash, walked into the emergency room and ran back because he was scared. If you had seen what it looked like before, then you understand the child was scared. So we have tried to make it more healing-friendly, where children do not feel like they are in some dreary place, but an environment that allows social interactions and makes you feel comfortable. We have also provided bed screens to ensure privacy and dignity. I mean, everyone understands that we all need our dignity and privacy. So for people on the wards, yes, they are babies, but it's still nice to ensure that the families have privacy while they are being examined and all. We have also provided multi-parameter monitors. There are bedside monitors that check ECG, pulse rate, heart rate, oxygen level at the drop. So no one has to run around with a spig and a thermometer. It's right there. You can tell. So there's a special room. I'm Dr. Ameze Guavon. I'm project director for Lluvia Health Organization. Today we are unveiling a project. It's titled Creating Healing Environments on the Pediatric Emergency Center at LUTH. And basically what we have done is we've looked at the health needs of patients in hospitals, and we've decided to go beyond just equipment and infrastructure to actually looking at the social and psychological needs of children and their caregivers.
Join with our partners, and we do appreciate that once the children grow up, we grow up with the children naturally. We make the children better, we make the mothers better, we make the families better, we touch their lives. Indeed, what we're doing is actually sowing into the future, because indeed these children are the future of our nation. And in making them better, in making their families better, we're sowing into the future of nation building. And that's the essence of being here today.
As sponsors of the event today, this is under the auspices of Cussons Baby and Premier. So we are really very proud to sponsor this laudable event, which is the unveiling of the rehabilitated Children Emergency Center at Idiaraba, Lagos University Teaching Hospital. And as I mentioned earlier in my brief brand's speech, this is not just a corporate social responsibility. This is actually more for us as seeing ourselves relating to the essence of the brand Cussons Baby, which is growing together naturally with the children, with the mothers, and it's also our way of actually making lives better, which is the mission of our corporate organization PZ Cussons. So this is more than just a corporate social responsibility. This is for us about nation building. The more of those children's lives that we touch, the more of their families that we touch, the more of their mothers that we make happy, and in doing all of these things, it actually culminate into a very big reciprocal effect on the entire nation.
Interestingly, for the better part of these 8 years, we looked at little bits and little pieces, and this was one of the most audacious things that we've done. For the CMD for giving us the platform, we say thank you. For Cussons for allowing us look outside the box to help the box. The box is never your problem. It doesn't matter how lofty your ideas are outside the box. If you don't have a box to implement it in, it doesn't come to any fruition.
If you look at the indices, in other words, the numbers and the statistics, nobody would sincerely say they are impressed. But what I'm impressed about is the fact that we have a group of doctors, pediatricians and general doctors, who have not given up